Hi, I'm Dana Curzan, and I did Swyers syndrome for my study case project. What is Swyers syndrome? So Swyers syndrome is when a female is born with the XY chromosomes, which is usually male chromosomes, but with female genitals and no ovaries. So anatomy of female reproductive system. I'm just going to go over the basics here. So the internal sex organs are the ovaries, the uterus, and the fallopian tubes. The external sex organs are the vulva, mons pubis, the labia majora, labia minora, vestibule, which is the urethra and the vaginal opening, and the vagina. So the anatomy of male reproductive system, again, I'm just going over the basics. The external sex organs are the penis, the scrotum, and the testes. The internal sex organs are the vas deferens, ejaculatory duct, urethra, seminal vesicles, bulbourethral gland, and the prostate gland. So you can see some of that in this picture. We got the seminal vesicle, the prostate gland, the vas deferens. So the basics of reproduction. So ovulation occurs once a month. On average, it occurs for 3 days. This can be different for everybody, but normally females ovulate once a month for approximately 3 days. Mature sperm and for males is formed and stored in the epididymis, which is located on top of each testicle. And when a male ejaculates mature sperm into the vaginal opening, the sperm travels to the mature egg in the fallopian tube. Because when a woman ovulates, the mature egg travels down to the fallopian tube. So once the egg is fertilized, the zygote or mature egg travels to the uterus, and it kind of implants itself into the endometrium, which is the inner layer of the uterine wall. Gonadal differentiation. So during week 8 of gestation or pregnancy, sex or gonadal differentiation takes place. So females are born with the chromosomes XX, while males are born with the XY chromosomes. Wolffian duct is a structure associated with males, and then equivalent is the Mullerian duct for females. And then there's the bipotential gonads that are either going to be turned into ovaries or testicles. So this is for normal gonadal differentiation. So the male process is the SRY gene on the Y chromosome, as you can see right here. It's also known as the sex determining factor. So that's going to determine whether the baby's going to be a female or a male. So the SRY gene secretes SRY proteins that stimulate those bipotential gonads, the ones that are going to be turned into ovaries or testicles. It stimulates them to form into testes. So the testes will then secrete testosterone, which causes the Wolffian duct, the structure, to become seminal vesicles, vas deferens, and epididymis. Oh, sorry about that. The anti-Mullerian hormone will be secreted, causing the Mullerian duct, which is the female equivalent to the Wolffian duct, to disintegrate, because at this point the gender is male. And this takes place between weeks 8 and 10. So the female process, females are XX chromosome, and without the Y chromosome, the SRY is not present. It's not on the X chromosome at all. So without the SRY gene, the SRY protein is not secreted, meaning the testes are not going to develop, and this leaves the bipotential gonads to develop into ovaries. So once the ovaries are developed, the Mullerian duct develops into the female reproductive organs such as fallopian tubes, upper vagina, the uterus, and the cervix. But the lack of testosterone is going to disintegrate the Wolffian duct, which is the male equivalent to the Mullerian duct. So with Swyers syndrome, when Swyers syndrome occurs, the Y chromosome, is mutated. So during gonadal differentiation, the SRY gene on the Y chromosome is not active. So the chromosomes are XY, but the SRY gene is not activated. The sex determining gene. So the bipotential gonads do not develop into ovaries or testes. And when that happens, these gonads turn into something called streak gonads, which means they're not properly developed. Because there are no testes, like in normal male differentiation, the anti-Müllerian hormone and testosterone are not produced. They're not secreted. So this disintegrates the Wolffian duct that is usually associated with males. That usually creates the epididymis, the vas deferens, and the seminal vesicle. And the Müllerian duct develops into fallopian tubes, the uterus, the cervix, and the upper vagina because of the lack of hormones secreted by the testes. So someone with Swyers syndrome will then be born female with XY chromosomes, with the lack of ovaries. So statistics, Swyers affects 1 in 80,000 women, making it one of the rarest gonadal differentiation syndromes. This syndrome can occur as a result of up to 10 different chromosomal mutations. I listed a couple examples. The one that we're going over is the mutation on the Y chromosome with the SRY gene, and that is approximately 15% of the cases. 18% of the cases occur from mutations on chromosome 5. Mutations on chromosome 12 and 9 have been recorded, but they're far less common. So, signs and symptoms of Swyers syndrome. This person will not ever have a menstrual cycle due to the lack of ovaries. Puberty is delayed or does not occur due to the lack of hormones produced by the ovaries, such as progesterone and estrogen. Undeveloped ovaries and testicles. This happens due to the mutation on the Y chromosome, so they're not going to have developed ovaries or testes. Diagnosing Swyers syndrome. This syndrome can be diagnosed by chromosomal testing, ultrasound. Ultrasound, they can see that there's no developed ovaries. Chromosomal testing, this person will come in with female genitals, but their chromosomes will come back XY. Same thing with an MRI and a CT scan as the ultrasound, is they will see that there's no ovaries. Swyers syndrome is not usually diagnosed until ages 15 to 18 because of lack of puberty and menstruation. So a lot of people don't notice the signs until they're 15 to 18 when puberty or menstruation usually occurs. So the effects of Swyers syndrome, long-term effects include infertility due to the lack of ovaries, loss of menstrual cycle due to the lack of ovaries, hormonal imbalance due to the lack of ovaries not producing progesterone and estrogen, bone loss and thinning, and then those streak gonads that don't turn into ovaries or testes, they have a higher risk for gonadal tumors. So treatment. Hormone replacement therapy is the most common treatment for Swyers syndrome. They administer estrogen and progesterone to help with the physical development of puberty, so they develop just like everybody else. Also, these hormones can help with bone loss and thinning later in life. Someone with Swyers syndrome can see a couple different specialists, such as an endocrinologist who specializes in hormones, a gynecologist, or a psychologist. And then those streak gonads that don't develop, they can be surgically removed to reduce the chance of the gonadal tumors. And these are my sources, and thank you.